we go.
Roper St. Francis Healthcare's House Calls TV.
Delivering the best care before you deliver. Dr. Allison Dillon explains how Roper St. Francis is using first trimester ultrasound to care for a baby at the earliest stages of development.
If you have a patient who's had a baby with a prior birth defect or a specific anomaly, sometimes we're able to go look for that. And that obviously gives the family a great deal of reassurance just to see that things are coming along normally.
Doctors first make sure it's not a tubal pregnancy and the baby's in the proper position in the uterus. Even in the first trimester, doctors can see the heart beating and the brain forming.
First trimester ultrasound is also very important for dating pregnancies. A lot of times women don't know how far along their pregnancy is. If you can accurately determine how far along a pregnancy is, it really helps with the management of other issues down the road.
This ultrasound isn't appropriate for every woman, but for high-risk patients, it can reassure a mother that everything is fine or help doctors recognize any existing abnormalities.
This is another reason that women really need to come in, establish prenatal care early in the first trimester so that they have all their full selection of options available to them for testing and evaluation of their pregnancy.
For more information, call 402-CARE. For House Calls TV, I'm Merritt Buck.
Roper St. Francis Healthcare's House Calls TV.
What if we could change your idea of what premium ultrasound can do? What if you could see anatomical structures earlier with a transducer that offers image resolution you have never seen before? Introducing Philips IU22 X-Matrix ultrasound system with the X61 Pure Wave transducer, a new milestone in premium OB ultrasound. Philips' revolutionary new X61 Pure Wave X-Matrix array transducer features more than 9,000 active elements, 35 times greater than conventional transducers.
Every one of those creates an ultrasound beam that creates an ultrasound image, and that ability to electronically focus the ultrasound allows you to put a beam in any direction and in any format.
You get a thinner slice at depth, you get finer detail at depth. Some of the feedback indicates people are seeing anatomical structures they've simply not seen before, because a conventional transducer would average those structures together with other things in elevation. What the clinician will experience is finer anatomical detail, better image uniformity over range.
What if that one transducer could provide the ultimate versatility in clinical imaging? With Philips' new X61 Pure Wave X-Matrix transducer, you no longer have to change transducers during an exam, since it offers superb performance in all modes at the touch of a button, including 2D, Live X-Plane, MPR, and 3D 4D. The result? Fewer disruptions, better workflow.
Before, a user either had to choose between just 2D imaging where they could get a high frame rate, or volume imaging where they could get the entire volume and see planes to that volume but may not be able to get the frame rate that they need. The X61 provides better spatial resolution in all planes, and so that's going to give better anatomical detail to get all their standard views.
But in addition to that, because it has this better resolution in the 3D images, you can also use Live 3D to look at limb buds. You can look at early fetal development. You can look at early fetal motion.
What if you could capture a fetal heart volume in as little as 2 seconds? Collecting volumes for fetal heart assessments can be time-consuming and sometimes impossible when the fetus moves.
And if the fetus moves during that stick acquisition, really the data set is no good. And you don't find that out until after it's done the reconstruction, several more seconds later.
So you've just spent 15, 20 seconds of workflow and you have to start all over again, possibly with new positioning.
With the iStick technology on the X61, you can acquire the volume in as little as 2 seconds versus the standard 12 seconds, providing more usable volume information faster with better B and C plane imaging quality.
First, the acquisition is very fast. By dividing the time it takes to perform that acquisition by approximately a factor of 5, your chances of getting a successful acquisition go up by about that amount as well. Then you also have an estimate of the fetal heart rate in advance. So the system is literally imaging the fetal heart in real time, estimating the heart rate from it, and giving you a number before you acquire.
What if you could view two images with superb resolution at once in real time? Live X-plane imaging on the X61 allows for simultaneous high-resolution real-time scanning in two planes without moving the transducer. You no longer have to rotate the transducer to see the second plane. You can maintain a reference point while surveying anatomy. What if you could export your volume data to any PACS in CineLoops? Now, for the first time, you can capture your X, Y, and Z MPR CineLoops at the push of a button on your IU-22X matrix system, and then send them to any PACS, where you can view these images just as you would with CT or MR. Introducing the IU-22X matrix ultrasound system, a new milestone in premium ultrasound that will change your approach to OB exams, increasing confidence, reducing exam time, and bringing more information to every exam.
If you were to add up all the human years that went into the effort behind it, it's many, many decades of human effort that have gone into this transducer.
I frankly think it's the biggest breakthrough that I've experienced in my career, and I've been involved in ultrasound essentially for 25 years now.
Well, this is a new type of birth centre offering support before, during and after pregnancy. Now, Sarah and Oscar are 7 months into their term and this is their third visit.
Hello, you two again. How's it going? Good, thanks, Liz, although I feel much better after the scan.
We're hoping that everything's still okay.
Are you eating better?
Yes, it's been much easier, thanks.
She started to crave ice cream.
Ah.
And is going through 2 tubs a day at the moment.
Oh, that's a secret. Don't you worry, I used to crave peanut butter. Now, let me help you with this. There it is.
Thank you.
Okay, it's exactly the same as last time. Integrated into the belt are ultrasound scanning heads. These provide a 3D volume scan of the baby, and we're going to look at the results of the scan to get the baby's development. I'll talk you through it as we're going along, okay? The ultrasound textile scanning belt allows me to make high-resolution scans without the discomfort of the ultrasound probe. And because of the hard gel padding on the belt, there's no need for that messy ultrasound gel. It's quick, hygienic, and a lot more comfortable than when I was doing it years ago.
Yes, my mum was really jealous when I told her about it.
She was complaining about the gel being freezing.
We can also zoom in so we can get a closer look. And we can also look at them from different angles. Now, because this is your third scan, let's have a look and see how he's progressed. Okay, this is him at his last scan. He was 6 pounds, a little bit underweight. This is 2 scans ago, so you can see how well he's progressed.
4D scan visualization allows both parents to playfully and intuitively discover their baby. And the fourth dimension is time. The imaging specialist can rewind back as many scans as she likes, and the smart algorithm inserts the in-between frames. So we get a complete and seamless record of the baby's growth and development.
Okay, just like last time, if you stroke the belt, you can change the view of the scan.
Oh, can I check the pedescope to see if it's been updated?
Oh, please do.
Do you want to listen to it?
Yeah.
Yeah, it's on. Can I have a go? That's amazing. Right, there's plenty of time to look at this at home. My mum's flying in and she'll be absolutely thrilled to see this.
This is the bebescope. It's a small, portable, wireless device which records the scans and the heartbeat of the baby. Now this goes home with the parents so they have a memory to share with friends and family. They can zoom in and out like they did at the birth centre. They can watch 4D movie sequences, listen to the heartbeat of the baby, and rewind to rediscover the growth and development of the baby as well.